Good morning or good evening for those joining us in the US. Thank you for joining us for episode 19 for COVID-19 update. We've been doing this webcast about COVID-19 since February. And of course, a lot has developed from February until July. And today we have a wonderful, eminent expert on public health to speak with us on COVID-19 today and giving us kind of a global view of what's happening, and also some of the questions that you may have. Especially, I know many of you have been really concerned about school reopening. Some of our members have been wondering about that. So today, before we get started, just a quick overview of what's happening around the world. And today, July 29th, and today's topic is really looking at US, Europe and India, but also we want to take this opportunity to talk about what's happening elsewhere in the world and what are some of the issues. I think today, let's see, the numbers are not good, and especially here in Hong Kong. For the last week or so, our numbers have been over 100 in terms of local transmission. And in fact, today, no dine-in has been will start today here in Hong Kong for 1 week. So restaurants are all closing except for takeaway. So in Hong Kong, we're definitely feeling kind of the third wave of the COVID-19 pandemic. And globally, 16.5 million have been infected, about over 654,000 deaths. US alone is 4.3 million and around almost 150,000 deaths today. India, which is also quite high up there, about 1.5 million infected, about 33,000 deaths. And here in Hong Kong, although the number is low comparatively speaking, but it has been, as I mentioned before, rose dramatically this last week. We're right now over 2,700, and we have had over, I think it's the last, as of yesterday, 20 deaths. But the 20 deaths compared to about a week ago, we only were about 12. So the numbers are kind of worrying here in Hong Kong. So today, our expert, Dr. Ashish Jha, is the KT Lee Professor of Global Health at the Harvard T.H. Chan School of Public Health and Director of the Harvard Global Health Institute. He's a practicing general internist and is also Professor of Medicine at Harvard Medical School. He received his MD from Harvard Medical School and is trained in internal medicine at UC San Francisco. So we're delighted he's here with us from Boston, and he has done groundbreaking research around Ebola. And it was on the topic of Ebola that Dr. Jha joined us here in Hong Kong Live in May of 2016. So we're really delighted to welcome Professor Jha back to Hong Kong, this time virtually. So Professor Jha, welcome.
Thank you so much for having me back.
Okay, I want to just kind of get started to talk about the general development around the world. And I know that we have billed this as talking about US, Europe, and India. But I think it would be great for you to right now, as of July 29th, what is happening around the world and giving us kind of a brief take on from your perspective. And what are some of the things, trends, and worries that you may have?
Great. Yeah, so thank you for having me back. And yes, about 4 years ago, I spoke at the Asia Society in Hong Kong, and I've been coming to Hong Kong a couple of times a year for the last, I'd say, 5 years or so. And when I spoke 4 years ago, and when we talked about Ebola, the key point coming out of that conversation was, how do we prevent the next global pandemic? How do we prevent exactly what we are seeing today? And I think there are important lessons from the Ebola experience that we can come back to and talk about. But if we take a snapshot on where we are, so you asked, Alice, where are we on July 29, 2020? What I would say is, in my mind, as I think about this pandemic, I think we are still in some ways in the early days. I don't think we're through the halfway mark of this pandemic. And I guess if I think that it began, we think of this pandemic beginning in January of this year. Certainly for the world, it began in January. For Wuhan and other parts of China, it probably began a couple of months before. And if we think it will come to an end when we have vaccines that are safe and effective and widely available, which I expect to happen sometime next year, maybe in May or June next year, we have more days ahead of us than we have behind us. So that's, I think, one level setting experience. So we have to kind of remember there's a long way to go. Second big picture point is that this really is truly a global pandemic. And so we are seeing the disease ravage countries around the world. What began initially in China and really hit East Asia next, really devastated parts of Europe, though I would say Europe has largely gotten it under control after some very painful months. After Europe, it hit the United States, and the United States has really fumbled. They have arguably the worst performance of any major country in the world, and you could make a case that's than any country in the world, period. Though there are some other countries that have also done a poor job and are, I think, competing with the United States for the title of worst performer. Across Latin America, we've seen incredible amounts of suffering, a lot of large outbreaks. Peru, Chile, Mexico, all have suffered immensely. And then, of course, the country in Latin America that has really done the worst is Brazil, which continues to have large numbers of cases every single day. Just very quickly talking about the South Asia and kind of the South Asian subcontinent. India actually was, in my mind, started off very strong. They locked down early when they didn't have very many cases and remained locked down for a while. And my sense and hope was that India was developing a plan for what they were going to do when they ended the lockdowns. But it really now looks like they didn't, or not much of one. And so now we're seeing India rise very quickly, but without a very clear set of plans for how to keep the virus under control. So I am very, very worried about India. And I increasingly worry that within the next month, we're going to see India become the global hotspot. Obviously, I would love for that to be wrong, but they're still so early in the disease. So few people have been infected and so many more to go, that I would not be surprised if we got to a point where India was having 75 or 100,000 new cases a day and 1,000 deaths a day. That's, of course, a nightmare scenario, but I think it's entirely possible in India. Let me maybe just make a couple of other high-level remarks, and then let's get into some questions. There's some good news as well about this pandemic. As of compared to 3 months ago, I can say today that we have two therapies that we know work: remdesivir and dexamethasone. Both of those have been shown in clinical trials to have real benefit for hospitalized patients, and so I think our treatments for this are getting better. And then we are making incredible progress on vaccines. Usually it takes 5 to 10 years, sometimes longer, to develop a vaccine. I've already alluded to the idea that I believe by sometime in early 2021, we will have a vaccine. And I'm happy to talk more about vaccine development, but I really am very optimistic about where that's going. So that's kind of the state of play, early, but some clear areas of progress.
Great. And yesterday, when I've been doing a lot of webinar and Zoom and hearing a kind of a global health expert talking about this is really unprecedented in terms of in 6 months, the vaccine has just really, we're hearing so much about it from the private sector. And but before we get there, I guess I want to start off this morning or this evening with some hopeful message about the vaccine. So can you touch upon some of the vaccines that you're looking at? I know we've heard about Moderna when we were with our colleagues in Houston when we did this COVID update a few weeks ago. They were talking about Moderna, and just kind of give us some quick updates on what are some of the vaccines that you think that will be coming up first, let's talk about vaccine first.
Yeah. So let's start with some good news first. Again, remarkable progress. There are over 150 different efforts to make vaccines underway. Last time I checked a couple of days ago, I think there were 18 different vaccines in clinical trials. Today, Moderna is launching its phase 3. Oxford, AstraZeneca also launching a phase 3 trial. I think of as the main event. Phase 1 and 2 are sort of the warm-up, where you figure out, can you even play in the main game? And phase 3 is when we get to figure out, does the vaccine work and is it safe? And in all of these, they're going to be testing the vaccine in tens of thousands of people in each of these trials. The vaccines are all different. The Moderna vaccine is an mRNA vaccine. Basically, it's the genetic encoding of the virus encapsulated in a protein. And the idea is that it will set off an immune response. And so far, all the data I've seen is very promising. Also promising is the Oxford AstraZeneca stuff. That is a vaccine that where the clinical trials were released, or again, phase 2 trials. So the warm-up trials were released a couple of weeks ago in the Lancet. Also seemed to show real immunologic response. They all use the AstraZeneca, the Oxford AstraZeneca uses a chimpanzee virus that will infect some human cells, but generally is not harmful, doesn't cause human disease. It's a chimpanzee adenovirus, and it has been modified to express the spike protein of the SARS-CoV-2 virus. So, but there are a whole bunch of other platforms, deactivated viruses, other mRNA viruses, other mRNA vaccines. The bottom line here is, and then I should also say that there's a set of different vaccines being developed in China, some using older technology, some using newer technology, also quite far along in development. And so put the whole thing together, and people say to me, well, which one of these vaccines will work out? And I say, I don't know. It's an honest, I don't know. They all look promising. They have different strengths and weaknesses, but we're still in the pre-game. And once we get into phase 3 trials, I would not be surprised if 3 or 4 or even more vaccines end up meeting the criteria for safety and effectiveness and becoming available. And that would be great because we've got billions of people to vaccinate. And I don't think any one company is going to have the capacity to build enough and make enough vaccines. So my best guess is later in 2020, let's say November, December, we will have data from these clinical trials phase vaccines starting to get widely distributed.
And one of the, I remember I was watching some of the webcasts that you've done earlier in July, and you had predicted, you had said something to the fact that maybe China might be the first one to get the vaccine. Do you still feel that way, end of July?
Yeah, I do. I mean, China has been, first of all, there are a bunch of different Chinese vaccines, some supported by the government, some a bit more private sector. But China's been moving consistently pretty fast, and I would say a few weeks to a month ahead of a lot of the Western vaccines. There are some questions about the platform China's using and whether it's going to allow for billions of doses, whether it will be as effective. We will have to see. But everything I've seen coming out of China, the data coming out of China, makes me optimistic that the Chinese vaccines will work. And I would not be surprised if China was to get there first. Of course, and I can come back to talking about this, I think of science as a deeply global endeavor. That said, it will be very interesting from a geopolitical point of view to see what happens if China starts vaccinating large numbers of people with a vaccine that's found to be safe and effective before America or Europe has a vaccine that's available. So that'll create some rifts, I think, in the geopolitical world. But from a science and public health point of view, I just want whoever can produce a vaccine safely and effectively to get there first, start vaccinating people, and we'll get more vaccines as time comes along.
Well, I think you also mentioned, and I think it's a well-known fact that India also provides a lot of, vaccine in terms of manufacturing vaccines and pharma. And what you has just said earlier about the unfortunate, if there was a rise in COVID cases in India in the coming weeks, it may affect some of the supply chain, the vaccine supply chain. So, are you still concerned about that?
I am a little concerned about that. I do think this is one of the things that we saw from China initially when China in January and early February was in really bad shape and they had to shut down large parts of their country. What you saw was disruptions in a lot of the things coming out of China. India is a major supplier of vaccines and of pharmaceuticals. And so far, it's been able to keep that supply chain going. But I do worry that if you start seeing very large outbreaks, imagine in some of the key factories, large numbers of workers end up getting infected and sick. It's going to be very hard to run those factories without those workers. And so I think these vulnerabilities in our supply chains are often underestimated. And these supply chains are so intricate in that, India makes a lot of pharmaceuticals, but a lot of the active ingredients for those pharmaceuticals come from China. And so a hit on Chinese production makes it so that the Indian companies can't produce the medicines that Americans consume. It's all part of a global supply chain. And we really do have to pay very close attention to all of it to make sure that even if we develop a vaccine, that we actually can make enough so that people can get it.
Well, I find this really interesting. It's kind of this paradox right now with this COVID. We're all kind of locked down. None of us could travel. We're all in our, homes for the last 6 months or so. And we are kind of in our little corner. And somebody said this is kind of a deglobalization as in at its finest, I guess. And then on the other hand, what you've talked about with India and also China in the early stages when we were talking about the PPEs and the masks and so on, China's really has the bulk of the world supply. So
Yeah.
in some ways, yes, it is a local disease. We're all locked down, but we also need that global supply chain. So one of the things now I want to turn to is really the importance of institutions connecting us. I mean, we have the UN, and now I want to kind of turn to the institution of WHO, which has gotten, fortunately, getting some criticism from the U.S. government, particularly President Trump. So can you kind of talk about, I know when you spoke for us in May, we had talked about WHO, the WHO's in a really important role in the in Ebola and global health crisis. And so, fast forward 2020, we have this a global pandemic like we've never seen before. So can you really talk about, the importance of institutions like the WHO, and, are they doing a good job? Is the criticism on the part of President Trump valid?
Good questions. So let's talk about WHO and institutions in general. We really do need to rely on global institutions to get us through global pandemics. It can't just be heroism of individuals, and institutions are important. Often they are underappreciated, but in moments of crisis, institutions are critical because they've set up rules for engagement that we don't have to and want to repeat and recreate in the middle of a pandemic. So so when I spoke at the Asia Society a few years ago about the Ebola response, I was quite critical of WHO, and I have been in the past quite critical. And my general feeling about WHO is that it's an organization that was created around 1950 and 1949, or 47, but somewhere around 1950, really with at a time when globalization looked very different, when international institutions looked very different. And, there has been a bit of an identity crisis of what is the purpose of WHO. And I think there has been mission creep at WHO. They often work on too many things. And I have been critical. And I've said, look, you got to focus on the things that only WHO should do. And they didn't respond as effectively as they should have at the Ebola outbreak. But that said, WHO did undergo a lot of reforms, not all the reforms I wanted, but many of the reforms. And I would overall say in their performance in this pandemic has been dramatically better. They have a health emergencies program run by a guy named Mike Ryan that I think has been really quite extraordinary. I think Dr. Tedros has been very visible on the global stage about this pandemic. But if the question is, is there any validity to the criticism of WHO? Yeah, WHO has not been perfect. Some of their communications have been, I think, at times not very effective. I think the way they handled China initially was not what I would have suggested. So I have criticized them. I spoke at the Senate Foreign Relations Committee of the United States a few weeks ago, and was very explicit about where WHO has had shortcomings. I think their excessive praise of China as a way to try to get access into China was unnecessary. I think it was unhelpful. So WHO's performance has not been perfect. That said, it's been very good overall. It's been instrumental, really driven by a desire to blame somebody else. And I've said to the Trump administration, if you want a scapegoat and you want to blame somebody, blame China, where you could easily make the argument that the performance of the Chinese government in November, December was not what it should have been. But instead of directly criticizing China, they have decided that they're going to pull America out of WHO. I think this is incredibly short-sighted. I think it's going to be harmful to the United States. It will be harmful to WHO. And in the long run, leaves America much weaker and much worse off. So institutions are never perfect. We have to know what their strengths and weaknesses are, what their capabilities are. But criticizing WHO for limitations that are designed to be limitations strikes me as silly. We should understand that it is a limited organization, as every organization is, and judge its performance based on that.
I think one of the things now I want to touch my really kind of more the institutions on the local side, like the CDCs and so on. And I remember earlier in the pandemic, I saw an interview with Dr. Zhong Shan from China, and he also has some interesting advice about maybe when this is over, advice about Chinese CDC. I didn't understand. Apparently, the CDC in China is not like the CDC in the U.S. The way that the answering, the way they are organized. So he himself had mentioned on a TV interview that also after this, all the institutions really need to learn from the mistakes and reorganize. And kind of like you said with the WHO and Ebola, the criticism were valid. They obviously learned from it, and then they made the institution better. So can you now? One of the things I want to turn toward to is really the U.S. CDC. There seemed to be a personality, a struggle with Dr. Fauci, whom I remember being in the United States around the time of the Ebola. And and also the other crisis that going on. He has, as a scientist, kind of using facts, like you also provide. You also are a proponent of fact-based, science-based. So can you talk about kind of the difficulties of this particular right now with the U.S. CDC? It seems to me what you have talked about the U.S. the confusion and sometimes you're wondering why is not Dr. Fauci on the stage? Why is it President Trump on the stage? And for a long time, for a couple of months, President Trump decided not to do the briefing. Now he's back. So can you kind of leadership, I guess, is what I'm asking about in terms of this. We're talking about institutions, but also leadership is something that I wanted to kind of get your takes on that.
Yeah, so let's talk about both institutions and leadership, and obviously they're related. The US CDC has arguably been the world's premier public health agency, and certainly one of the reasons why the China CDC was named the CDC, or the Africa CDC, was they were in many ways modeled after the US CDC. Not exactly, and of course every country does it differently, but the US CDC has really been the gold standard for how you do these things. And the problem, I think, speaking very bluntly here, the American CDC has been sidelined and politicized by the Trump administration in a way that I think most of us are shocked. I wrote a piece at the end of January, shows you how much I know. I wrote a piece at the end of January that said America's response to COVID was going to be quite strong because we have a great public health agency. And it turns out I was wrong. I was very wrong. And I was wrong because I assumed that the CDC would be allowed to function. And in fact, the CDC has been suppressed and sidelined. And the head of the CDC, the US CDC, is a guy named Robert Redfield, who has been abysmal. I think his performance has been shocking. He has undermined his own scientists. He has criticized Dr. Fauci when Dr. Fauci has spoken up using science and evidence. And I think this will go down as one of the sort of more shameful moments for America's institutions. The FDA, which has been better, the Food and Drug Administration, has also struggled with some of these same issues, really driven by the fact that the leaders of these agencies have not been willing to stand up to political pressure and have compromised and undermined their own scientists in order to favor or to curry favor with political leaders. So it's a very distressing moment in the US to see this premier agency, to see these great scientists who are still there working very, very hard and not being able to accomplish what they must be they are clearly trying very hard to accomplish. So that's the CDC. We have Dr. Fauci, as you know, is at the NIH, and he has been he's America's physician in many ways, we call him, He is the person who speaks science and truth and facts. And he has largely continued doing that, and much to the aggravation of many, many political people in the White House and in Congress who don't want to hear it from Dr. Fauci, who don't want to hear the science. But America does, and he remains immensely popular in the United States. Most Americans want to hear from Dr. Fauci, and so even though he doesn't get to do it from the White House stage because the president wants to do that, he is willing to still get out there and speak to people about what's happening with the pandemic.
Well, now I think this is an area where I also kind of want to seek your advice. I feel in the U.S., what I'm seeing I'm speaking as a Chinese American, and it's the FEMA. In some ways, it kind of reminds me of Hurricane Katrina and FEMA. I mean, we have institutions, and if they're left doing their work, they can do a good job or a relatively good job. But when it's politicized, then it's just, and you have to serve the people during crisis. Institutions are very important. So, speaking as somebody who's an institutionalist, I think you need both in terms of the leadership as well as the institution. So, I think what you touch upon is really disturbing to hear. But I hope in the end, science wins out. But why is this? Even the pre-COVID, there is this fear of science. I mean, I feel like we're living through the scope monkey trials again. I mean, even with the pre-COVID, the anti-vaccine people in the U.S. was quite powerful. And why is it for a country that is, America is, in terms of its science, why is this distrust of science? And now we're seeing it in terms of the anti-mask. That has become a political issue, which I find fascinating. Here in Hong Kong, in fact, it is the law now as of this week. We inside, outside, we have to wear a mask, and everybody does it. And even before the government's order, we were doing that. So why is this tug of war between the science and why is there this science deniers? Is what I'm trying to better understand.
It's a very good question. It's a very good question, and to some extent, Alice, I'm not sure. But let me try to give you my best assessment. My sense is a couple of things. First of all, there's always a fringe element in almost every society of people who question whether the earth is round, who question climate change, who question almost every fact, right? But they tend to be fringe, they tend to be small, they don't largely infiltrate major political parties, they don't end up becoming major movements, we generally hope. In America over the years, there has been a growing concerted effort to spread misinformation, largely through social media like Facebook. I think Facebook is probably the single biggest culprit in spreading misinformation across the United States. It's been amplified by political leaders who saw political advantage in amplifying this misinformation. And all of a sudden, you find that instead of 5% of your population believing in this kind of fringe nonsense, now you have 30 or 35% of the population. And that ends up being a really major part of a political movement. So it has really become hugely problematic. I know a lot of political leaders who feel beholden now to that crowd that believes that that vaccines are created by Bill Gates to do mind control. I mean, just crazy stuff that like normal adults don't think has become, again, it's still a minority view, but a very large minority view. I think it's in some ways an indictment of our education system that people can't separate out facts from falsehoods. It's also an indictment, I think, of our social media companies that have promulgated this and let it fester and have argued it's all free speech. And in the interest of free speech, we want to have misinformation out there. And so and then of course our political leaders who've exploited it. So I think it's a combination of all of those things, but it is shocking. I mean, it's shocking at times to live in a country where, again, majority of Americans, I think, do believe in science and care about science, but this increasingly growing minority has become quite emboldened to spread misinformation.
Well, it's interesting when in my research, the Antimass League of San Francisco, they actually existed during the 1918 flu pandemic. So there was coming out of San Francisco. So even about 100 years ago, the anti-mask people were out there. But like you said, in terms, thanks to social media, they are getting a lot more airtime. But also, I want to thank Facebook Live and YouTube and Zoom for being allowing us to bring a program like this, because when we initially started the program in February, was very much with the goal of countering that, because whenever there's things that I don't know, my instinct is ask the experts, directly ask the experts. And so that's why we're delighted to have you here with us. And I just have a couple more questions. I know we have 30 minutes left, and thank you so much for taking time from your very busy schedule to be with us. And I wanted to now talk more about the kind of what we're going through now, and I think also the U.S. is going through in different states in terms of the here in Hong Kong. Thank you, Dr. Gabriel Leong. We know that the term suppress and lift. We're very familiar, and we're definitely in this suppression stage. And in the states now, the various states have opened up, and they're seeing the rise in the numbers, definitely in Florida and Arizona and some of the states. And obviously, we answer the question of seasonality. Seasonality doesn't kill COVID. In fact, in February, when we had our first discussion with Professor Ben Cowling, we were hoping, and I have to say, in February, come July, COVID would be history, kind of like SARS, but obviously not. So, can you really? You are a proponent of TTSI about the social distancing, lockdown, and mask, and so on. Can you give us an insight on what is happening in the U.S. in terms of the various states, and also what's happening in your own states, and how it relates to? I think one of the big questions now, it's July, end of July. Schools, a lot of parents here in Hong Kong, the school has been locked down. There have been no schools since Chinese New Year, January. Although I think for a couple of weeks they opened, but then with the rise, school closed again. So can you talk to me about some of these issues and how it's going to lead to some of the decisions? How should we make the decision about school closing, school reopening, and on that topic?
Yeah. So let's talk a little bit about where the various states in the U.S. are, and then we can talk about schools. So right now, America kind of can be, I think, broken down into three buckets of states. One probably makes up about half the country where things are very bad. Large outbreaks, largely driven by opening up too soon when their case levels were still high, and opening up too much, opening up bars and restaurants and gyms, and basically acting like the pandemic was over. And those states are having terrible outbreaks. They are the Arizona, Florida, Texas. Some evidence that Texas and Arizona is starting to kind of flatten things out and maybe even turn it around, but still with a very high level of cases. So again, there are probably about half the country lives in about 20 states where the outbreaks are quite bad. Another 10, 15 states, the outbreaks are not so bad, but they're heading in the wrong direction. You can see large increases on a day-to-day basis. And I'm worried that in the next couple of weeks, they're going to be one of those hot zones. And then you have probably about 10 or 12 states that are doing pretty well, that locked down effectively, have kept things reasonably shut down, have opened up slowly, and they have relatively low number of cases. A couple of them are starting to see upticks, but are doing reasonably well. So when I think about schools, what I have said is I don't see any way that you can open up schools in the hot zones. When you have in Florida 10,000 new cases every day, and you're not even identifying most of the cases because your testing is inadequate, there is no way you can open up schools, not for any extended period of time. In those middle ground states, I think it's going to be very hard. Even if they're not hot zones yet, if their case numbers are increasing substantially, I think it's going to be very difficult. And so what I have said is, hot zones need to essentially lock down universal masking until you get things way under control. Those middle ground states enforcing face masks, getting rid of some of the more high-risk things may be good enough. And then in the states that are doing reasonably well, I do think schools can open up. But it's going to have to require a lot of careful monitoring, a lot of testing, a lot of vigilance. It's not at all clear to me that it can happen easily. My guess is that 80% of American schools will end up being closed for much of the fall. I just don't think people, again, are taking the school situation seriously enough. I think more than 20% will open, maybe 50 or 60% will open, but they will quickly find that the cases are growing, there are outbreaks in schools, and they will end up shutting down. And that's where I'm worried. I think we can do better than that, but I don't know that we're really heading towards that right now.
You, in September, you're going to have a new job as the dean of Brown University School of Public Health. And but so I don't know if the university has consulted you in terms of the returning university students. I mean, right now,
Yeah,
one of the issues here we're paying close attention to is really the U.S. university higher education. And because of the visa issue, no visa if you're taking classes online. So can you kind of give us an insight on that? Because I think there's a lot of concerns here about studying, and whether it's international students or but yeah, I think that's
yeah.
an issue that I would love your advice.
Yeah, so a lot of universities are going online in the fall, and they'll probably end up being online in the spring as well. Brown University, where I will be starting a new job in September, I have been in close contact with the leadership. The president of our university, Chris Paxson, made a commitment early to try to figure out if we could open up safely. And so she has put together a very kind of august task force of people, and I've been helping and advising as I can. And the plan is open. Now, we may decide at the last minute if the number of cases in the community gets too high, or if the cases across the country are too high, that we may not be able to do it. So I think that's always an option. But as of right now, to me, it looks like it's a go. We're probably going to move forward with opening.
Um,
That said, yep, sorry, go ahead.
go ahead, please.
No, but opening is not the same thing as returning back to normal. So we have taken what are typically 2 semesters and turned them into 3 semesters, and basically said everybody only has to attend 2 of the 3. The professors only have to teach 2 of the 3. But it spaces things out. All of a sudden, automatically, you get a third of your class, students staying at home at any given time. Then we're moving large lectures to online. We're doing a lot of other changes, testing students and staff regularly. There's a whole program and plan in place to really get this, to try to stay vigilant and on top of the virus. Am I 100% sure we'll be successful? I am not. It is entirely possible, after trying all of this stuff, that we still end up having large outbreaks. It's possible. But my general feeling is that if we can keep community transmission low, and if we are aggressive on campus about maintaining certain policies and testing and so forth, that there's a good chance we can keep the university open in the fall. But we will try. We will try. No guarantees.
And how about Europe? Right now, I know Europe seems to be opening up in terms of tourism. I mean, at least local tourism. Unfortunately, I think there's some incident with Spain and UK. But I've been talking to friends in London, and they've been able to do trips and so on. So is Europe doing this right in terms of their opening up and the way they're managing it? And they also remember there's so many countries. They're not. It seems like everybody has their own issues, and they just passed after a lot of hard work the package to help EU recovery. And so how do you think Europe is handling in this area in terms of opening up?
Yeah, so I've been a little worried that some of the European countries have opened up a little bit too much and too fast, and we have started seeing cases rise in some places. The numbers are still pretty low. I mean, nothing like the United States. And so the key here is to watch what happens in the upcoming weeks. If Europe takes the kind of a laissez-faire approach and says, well, we'll just let the case numbers rise, things can get quite bad, and would get quite bad by the end of August, September. I'm hopeful that, having gone through pretty bad outbreaks in March and April, a lot of European countries are going to take this much more seriously, jump on it if the numbers start getting bad. We will see. So far, I would say Europe is looking okay, but there are enough warning signs in the data that I am concerned, and I'm watching for a policy response. And if I don't see a policy response in the next week to 10 days, I'm going to get very worried that they have not learned their lessons and they're heading towards a lot more suffering and death and economic damage.
Okay. Now I think we have 20 minutes left, and I wanted to turn to the Q&A from our audience. Those of you, feel free. I see a couple of questions coming in from Slido, but we're going to start off with a question from one of our members, Mark Michelson, who asked a question about PPEs. Concerns have been raised outside of China about the quality and reliability of some of the PPE and pharmaceutical products made in China. Do you think the concerns are justified? And even if they aren't, are there sufficient internationally accepted safeguards to ensure that a new vaccine will be safe and effective?
Yeah, it's a very good question. You know, products coming out of China, of course, like from many countries, vary. I mean, there are very high quality internationally. And if you think about the US, international quality products, I mean, if you think about pharmaceuticals that come out of China, they're inspected by the FDA in the United States and European medicine agencies. And so it clearly, some of that stuff is very high quality. And there's been no doubt products coming out of China, PPEs and others that have been found to be substandard. So China really is, I mean, it's a very large country. And what you see is a lot of variation across it. This is why I think it's very important for countries as they import products from China, especially these kinds of things, especially in the middle of this very difficult time, that they do have some sort of standards for assessing the effectiveness of the PPEs. In general, on medicines, fake medicines and substandard medicines, and actually substandard vaccines, has been a long-standing problem, both coming out of China, India, other places. And what's really ironic about it is, some of it is, people talk about the front door, back door problem, that you come in through the front door, you're an FDA inspector, you look at the factory, you look at the products, it's great, world class. But some of those unscrupulous operators will then run an evening shift and take the same active medicines and cut it in half, package it in the same pills, and that goes sometimes to an African market or other third world, sort of lower income country markets. So those kinds of problems have existed for a long time. I think we're going to want to worry a lot about that in the context of a vaccine, that we have to make sure that the quality of the vaccine is very high, and that those kinds of shenanigans that have happened, and by the way, they're not limited to China. We've seen that kind of behavior coming out of companies in India. We've seen it coming out of Brazil. So we just have to really be vigilant about making sure that that kind of stuff is not happening. Because obviously, substandard, poor quality, or false vaccines for COVID-19 will end up doing potentially a lot of harm.
One of the questions also is, this is about vaccine. Once the phase 3 trials and vaccines are safe, how can places like Hong Kong position itself to get early vaccines? We've already heard that the president has already ordered $1 billion and more and then his task force is by January hoping to have 300 million purchased. So how do you countries or territories like Hong Kong get help with that, with the vaccines?
Yeah, it's a very good question. And, of course, Hong Kong is wealthy. It's got a lot of social and political power in the world. And yet there are going to be challenges, and I'll talk about those. But I also really worry about the poor countries of the world. And, how does a Malawi, how does Bangladesh? I mean, Bangladesh is doing better, but again, economically, but still not an economic powerhouse. So there's just a whole lot of countries that you'd worry about how are they going to get it. I think this whole approach of kind of vaccine nationalism that we're seeing out of the Trump administration is counterproductive and unhelpful. What we need to do is produce global stocks of this. We need to make enough. So, for instance, the Oxford AstraZeneca vaccine, the makers of that have contracts with a bunch of Indian companies who make vaccines for the Indian market. So, I think if I were the health secretary or health leader of Hong Kong, I would really think about where are the major supplies of vaccines coming from already. And then how do we make sure that those manufacturers, those suppliers have access to the COVID vaccines, whichever ones are available when, and then how do you bring them in to the people of Hong Kong? So I think it's very doable. Hong Kong, of course, has some very distinct advantages, very global entity, relatively wealthy entity. So I would think that Hong Kong will do well in terms of being on the in line in terms of getting the vaccine. But I would worry immensely about large parts of sub-Saharan Africa, parts of Latin America, parts of South Asia.
And I think it's really important to know that even if we do get the vaccine, the other doesn't. I mean, in this world of globalization, I think we're still going to be traveling. So it is really important, but that we get it, but others get it as well, right?
Absolutely, absolutely. Because no country is going to have 100% vaccination rates, right? And so the truth is that in order to protect ourselves, we need to have large chunks of the world vaccinated. I often say to Americans, imagine we get to vaccines and 50, 60% of Americans get vaccinated. And then travelers from South Asia or Africa continue to come in and introduce the virus. It is not effective. And then they'll start circulating in the community. So it is just as important for America to make sure people in Africa, people in South Asia, people in Latin America are getting vaccinated. It's good for people there, but it's also good for the American people.
Okay. This is a question asking about from the US, obviously. Do you think it's necessary to implement a national mask law?
So there's a legal question there, and then there's a public health question there. So let me take the public health question first, and then I'll talk about the legal question, which I have less expertise in, of course. So do I think that every state, every part of America should have a mask law? Absolutely. I think it is critical. I think it would have major benefits. If 80, 90% of people actually complied with it, it would have a very large impact on the trajectory of the virus. So yes, I think so. I think there are some real questions about whether the federal government could pass such a law and whether they should be relegated to states. And so if, for instance, legally the federal government can't, then I'm fine with states doing it. But absolutely, it's important that every state have a masking law so that all their citizens can be protected.
This question maybe kind of related to also the states question too. The way I think in the states it's not been uniform. I mean, some states have performed better than others. And so I guess this question is, what makes the U.S. being the worst performer in combating COVID, and which country have done the best?
I mean, I think the U.S.'s abysmal failure here is largely due to failed leadership. I think you've had a president who has been in denial, has downplayed the virus, continues to downplay the virus, has sought to come up with one quick fix or another. There are no quick fixes for this pandemic. So America's failures are really multiple, but there is a bunch of ways that we have gotten to be the worst performer in the world. But I do think failure of federal leadership is right at the top of the list of things that have contributed to that. There is no shortage of success stories. I think there's quite a few. I certainly think Taiwan in general has done a very good job. Singapore, South Korea, often hailed as an exemplar. New Zealand has done a fabulous job. Hong Kong in general, I know that you guys have had rising cases. Often I point to Hong Kong as having done a very good job. Of course, not perfect. Almost no one is, but I do think Hong Kong has done a very good job. In Europe, Germany has been a standout, never really having had to take extreme measures, but good examples of countries that have taken the virus seriously, acted aggressively, and have managed to keep the virus under reasonably good control.
I think we in Hong Kong will have a ASHK election coming up in September. There's been talk of postponing it or canceling it or whatever. And so I think that is going to be on top of a lot of the government's mind and people's mind the next couple of days. In the U.S., we have the election coming up in November, and Singapore just successfully went through their election through COVID about a month or so ago. So what do you think the U.S., and right now I think the conventions are going to be definitely being affected in the United States. So do you think the political leadership, I mean, is COVID, and obviously it is now with the mask, it's been played into the political side of things in the United States. Do you have any advice? What do you think will happen, or maybe predictions with COVID and the election? Is that going to be a major election issue, do you think?
It may. And it's because in November, large parts of the country will be very cold. The flu season may have arrived, sometimes arrives early enough, October, November. So you can imagine that things could be quite tough in the United States in November when the election comes around. That's why I think a lot of people have been advocating for things like mail-in ballots, early voting, stretching out the voting so you don't have large numbers of people congregating indoors to vote at the same time. That all said, I think there's a lot of there are a lot of institutional failures in the United States. One of them is our ability to run elections. We really do struggle with running elections effectively. A lot of people are trying to put resources and effort into fixing the election, getting it. When I mean fixing the election, I mean fixing the problems of the election so that we can have fair and elections that people can participate in. But there are a lot of concerns that I think many of us have about how well the elections are going to go this November.
One of the questions, I guess, is really interesting. It says, if you were the head of CDC, what would your strategy of public health policy be? And how would you make the institution play a more influential and scientific role?
Yeah, I mean, I think, if I were the head of the CDC, first and foremost, I would make sure that the top scientists of the CDC did get a chance to speak to the American people. I mean, the way I look at it is those people's salaries are paid for by the American people. The American people deserve to get the benefit of those people's opinions. So absolutely would make sure that the scientists of the CDC are speaking directly. I would call for a science-based and science-driven set of policies, national rules on masks, or if it can't be done nationally, all the states should do it, aggressive increases in testing, making sure that there are no large indoor gatherings, the things that we know really can help with this virus. And, my sense is that the current director of the CDC at times has shown courage and has said those things, but many times has not stood up for science and facts, largely driven by fear of maybe losing his job. And my general feeling to the scientists who work within the US government and within the White House is if you can't speak up in the middle of a pandemic, what's the point of being there? What's the point of running the agency if you can't make sure that the agency is being effective? So I think whether it's Robert Redfield, Steve Hunt at FDA, others really have to ask themselves, why are they there? And how do they make sure that science and evidence are really behind the policies coming out of the White House?
I think we only have about 5 minutes left, and I'm going to get through as many questions as I can. But this question is really, coming from the audience saying, once a vaccine is launched, do you think WHO can take a role, shall take a role in distributing them?
I do. Sorry.
And shall wealthy nation make them free for people?
I do think WHO can play a very important coordinating role. There are a lot of policies and plans being developed right now for ensuring that there is widespread and equitable distribution of the vaccine. WHO is going to be central to that. They're going to certainly have to work with ministries of health across the world. WHO has a lot of expertise in the work that is done on polio. So there is nobody else who can play that kind of central role in getting that vaccine out broadly, the WHO. So I'm pretty convinced that WHO will play that role. Obviously, I wish America we were playing a more constructive role with WHO. But we will see. We will see what the status is. America has filed papers to withdraw from WHO, but is not officially out of the WHO. And with a potential change of government after this election, my guess is, assuming that change in election happens, a change in power happens, I expect that America will end up remaining in WHO and then hopefully playing a constructive role in getting the vaccine out to the world.
Okay, this is the last question. What's your reaction to voices saying that society continues to overreact? So many people have killed in car accidents, by influenza, etc., and we don't close society. Why should we do it now?
Yeah, I think that is a fundamental misreading of the data. Part of the reason that we don't close a society for influenza is, first of all, not nearly as many people die of influenza. This is a far more deadly, we think somewhere between 8 and 10 times more deadly than influenza. Second, is that one of the things we're learning is that that even for people who survive, there are very substantial, many of them, not all of them, but many of them, very substantial long-term effects, or as long-term as we can know so far, given we've only known about the virus for 6 or 7 months. So it's a very serious disease. And it has filled up hospitals. It has overwhelmed ICUs in lots of very wealthy countries. So it's a very serious disease. And part of the reason it hasn't killed more, even though it's killed far more people in the US, for instance, than influenza ever does, is that's after locking down large chunks of the country for many, many, many months. It still has killed 150,000 Americans. So I think this is nothing like influenza. And I don't know any other disease that kind of can so quickly overwhelm the healthcare system and cause as much damage as this virus does. So I think the general policies have been good. I think that aggressive lockdowns are only necessary if you don't have effective mask laws, if you're not doing good testing and tracing. Lockdowns really should be the policy of last resort. And I think if we play our cards right and handle this correctly, we can avoid that.
Is this a pandemic like anything you've seen before? Because I think the criticism from some of the critics have been saying, "Oh, the scientists got it wrong all the time." And in having done this almost 20 episodes of every time we do it, something happened. There's changes all around. So there's no way you could have it right every time. So the criticism, I think, has been unfortunate. But have you seen things like this? I mean, it seems like you mentioned it too. I think in other interviews, like the situation changes daily, if not weekly. And the criticism has been that scientists have to get it right. The criticism of Dr. Fauci and other scientists, oh, they've gotten it wrong all the time. So do you think that's fair?
I think that's deeply incorrect. Look, of course, scientists change. I mean, the fundamental principle of science is that when new evidence comes in, you want to update your opinion, right? Facts change opinion. Opinion doesn't change facts. So as we learn new things, it's a novel virus. We're learning new things. So have we been wrong about everything? Absolutely not. Some of the key principles that we've talked about from the beginning about washing hands, maintaining social distancing, I think all of us have been saying that since February, March. Still true. We learned by then there are some fundamental principles of how the virus replicates and how it gets into cells and the role of the spike protein. All of that has turned out to be completely right, which is the basis for all the vaccines we're building. Many of us have been arguing since early March, late February, about the importance of testing and tracing and isolation. I don't think there's any scientific evidence that doesn't work. It has actually worked quite effectively in Vietnam, in Singapore, in Taiwan, in Hong Kong, and yes, in South Korea, the gold standard for doing it that way. So, are there things where our views have changed? Absolutely. Masking, because we didn't know how important masking was. And I have to tell you, at the end of January, when I started seeing, I was actually at the very end of January, I was in Bangkok. And then I started seeing a lot of people wearing masks. And I remember thinking, this is not necessary. I don't think there's any real reason. And people have asked me, well, how could you have gotten that so wrong? And I think back to SARS. I think back to the SARS outbreak of 2003. And one of the big differences with SARS was that there you were only largely infectious when you had symptoms. And so if you felt well, you didn't have to put on a mask. Well, it turns out SARS-CoV-2 is a different virus, and it is infectious when you're asymptomatic. Did I know that in January? I didn't. Did anybody know that in January? No. Asymptomatic transmission is not something we really understood well in January. And we have learned, and since then we've changed our policies and recommendations. So I think people who want consistency actually don't care about evidence and facts. You get consistency when you're really dogmatic about things. Science is anti-dogmatic. Science believes in changing your views when the evidence changes. And I think that's exactly what we should be doing in a novel outbreak like this, and changing our views when the evidence suggests that we need to.
Well, on that, thank you so much for spending the hour with us. I want to give you the last word on, we mentioned already your new position starting in September at Brown as the Dean of Brown University School of Public Health. It's an exciting new role. And what is your thought, and what's your vision? What are you going to, will you be focusing on in your new role?
Yeah. Well, look, the Brown University School of Public Health is a brand new school of public health. It just was formed about 6 years ago. Of course, Brown University is a very old American university, one of the oldest, but the School of Public Health is very new. And I often say, it's the sort of the latest and public health school born in the 21st century, built for the 21st century. And what I mean by that is that I think the School of Public Health has to tackle some of the big 21st century public health problems, like the health effects of climate change, like pandemics, and how to prepare for them. So I think those are going to be important areas of focus. I also think that this pandemic has made plain to people around the world the importance of public health. And there is a massive hunger for knowledge around public health. And therefore, I really want our university, our school, the Brown School of Public Health, to be a place that kind of engages deeply with the world in teaching and education. So we really have to think about what that means. And I don't just mean, therefore, opening our doors to international students. So of course, we're going to want to do that and do that quite effectively. But really think about, what does it mean to educate the world? What does it mean to offer knowledge and evidence and data to a world that's very hungry for it? So a lot of work to sort that out. But one of my guiding principles absolutely is I want us to be a university that's deeply engaged in the world, especially around education and policy. And there's a lot of deep relationships between Brown and people in Hong Kong. And so this is stuff I'm learning as I'm learning about the university I'm going to. And so I'm pretty confident that that will create new excuses for me to come back and visit one of my favorite places in the world. And so next time I do, I will certainly come by and visit the Asia Society, and hope that we might get a chance to speak together again.
Please, we hope, we look forward to welcome you in your new role, and always, anytime. It's always great to hear from the scientists and those in the know, educators. This is a mission of Asia Society and Asia Society Hong Kong. I think our president says it really well. We shed light, not heat. And it's always great to have you. I know we will be traveling again in the near future, I hope. And I know we will have a wonderful opportunity to welcome you. And you have a lot of wonderful Brown alumni and friends here who are looking forward to welcoming you. And so on that note, I want to thank, we're slightly over, but thank Dr. Jha for being with us.
My pleasure.
Episode 19th. And also to bit of plug, episode 20 is coming up on August 12th. And this time we're going to talk to a couple of the recoverers, people who have recovered from COVID, including Professor Peter Piot. We had Professor Piot with us a few months ago, before he had the COVID, and now he's going to have an opportunity to come back to talk to us about his recovery process, and also our own president, Josette Sherman, who also recovered from COVID, and Warren Mock, a local talent, a wonderful musician, will also join us. So join us August 12th. And again, thank you, Dr. Jha, and thank you all for being with us this morning for a wonderful discussion on COVID-19. Stay healthy, stay vigilant, and stay safe. Times like this, we really need to kind of stick together and really focus on what is the science telling us, and also wear your mask. And we look forward to we'll seeing you online. Asia Society, unfortunately, is closed until after August 4th, and when the government hopefully will allow us to open. If not, stay with us online as we bring you more programs like this. Thank you.
Bye-bye.
Thank you so much.